Hello everyone, I just wanted to do a quick video on dental care this morning. It seems to be a question we get asked about quite a lot. So dental care in the cat and the dog mainly. I'll try and do one on rabbits later on because they're very different in the way that their teeth work. So the main problem that we find with cats and dogs is the build-up of plaque within the mouth, and the best way I can describe plaque is it's that sort of bacterial, slimy kind of feeling that you get. You say you leave some dishes in the sink overnight. I'm sure none of you ever have done this, but if you feel around the bowl in the morning, you get that sort of slimy feeling to it. That's biofilm. And that's essentially a population of bacteria that's been feeding on all the food overnight and essentially been reproducing and growing, and you get this film as a result of it. And that's what we get on our teeth, and that's what our dogs and cats get on their teeth as well. Over time, that film calcifies, so it gets calcium deposited in it, and that becomes something called calculus. So that calculus is the hard brown stuff that you see on the side of teeth sometimes. So kind of the teeth don't get cleaned, you get this plaque, this slimy stuff on there, and then it turns to calculus. Now, why is all this important? It's because the plaque and the calculus create a really nice microenvironment for the bugs to multiply in. So up by the side of the teeth, between the tooth and the gum, there is a little pocket there called the gingival pocket. And if you've got calculus around there as well, that all helps to create a really nice breeding ground for the bacteria. They then go up the side of the tooth and they get in around the bottom of the tooth. The gum starts to recess, it starts to move up the mouth or down the mouth if it's on the lower jaw, and the tooth starts to become wobbly and essentially it falls out. So yeah, the whole disease process results in losing the tooth ultimately, which isn't great. I suppose it's not the end of the world, you know, they don't have to be out there hunting down woolly mammoths anymore. But unfortunately, having that quantity of bacteria in the mouth can be a real problem, and the two biggest issues are, well actually no, the three biggest issues. The two serious ones are that population of bacteria, every time they bite it, goes into the bloodstream and it can get lodged on the heart valves and also in the kidneys as well, which can lead to problems. So they're the two sort of, I suppose, diseases that we would most get worried about. But you know what? It's painful. It's really painful. And I would say it's probably one of the major causes of suffering in older animals. Just having a set of bad teeth in their mouth. I can only equate it to what I would feel like. And I had a tooth root abscess a couple of years ago, and it was so painful. It was unbelievably painful. So yeah, having that in your mouth the whole time must be really quite unpleasant. And when you see a whole mouthful of them, the smell, you know, it just drags animals' health down. And sometimes we get animals in here in like 10, 11, 12, and we take the teeth out, or we clean them up, and they go home and people say, oh my goodness, I never realised, you know, it's like having a puppy again. So yeah, it is something that I guess we don't do enough of as owners, is just lifting the lip and having a look all the way along the side of the teeth and just assessing, seeing if there is an issue there and what we can do about it. So yeah, there's a disease process. It is an issue. What can we do to prevent it? Because prevention is much better than cure, which we'll come on to in a minute. So prevention, essentially, once calculus is there, unless you're in sort of hand scaling and all this sort of business, which isn't brilliantly effective, calculus is a problem. It needs to be dealt with through ultrasonic cleaning. That's the best way of doing it. It's the plaque. It's that slimy biofilm that you can do something about. And there's a myriad of ways of doing it. If you look at dogs or cats which tend to eat the diet that they've evolved for, so you know, sort of raw meat, eating small animals, that sort of thing, their teeth tend to be pretty good, and that's because the actual action of biting and chewing raw meat and bones tends to squeeze up the side of the teeth, and that cleans the teeth as they go. So yeah, I mean, that's something you could consider, but not all of us want to feed raw food. It's not always practical. So a lot of us feed dried food or kibbled food. Kibbled food isn't all that brilliant at cleaning their teeth, purely because as they bite it, it tends to shatter in the mouth. Yes, hopefully they chew, and that releases saliva, and saliva can then, well, it's got an antibacterial in it, and that can help to keep the population of bugs in the mouth down. But yeah, it's not brilliant, and some people then resort to dent sticks. I don't like dent sticks. I'll say it. I don't think they're particularly effective. I think they're well marketed, and there are a couple of companies out there that do them. I don't think they're brilliantly effective, and I certainly wouldn't recommend them for certainly, you know, if there is an issue in the mouth. Although you may well have a different opinion, it might work well for your animal. Of course, just rolling back to the individual animal, we all know the Labrador that just inhales the food. Well, they're more likely to get tooth-related problems, because if they're inhaling their kibble, and by inhaling I mean just eating it really, really quickly, they're not going to get the chewing action versus the dog that sits there and chews. Stimulation of chewing, I think, is really, really important. So there are a myriad of things out there that they can chew. So antlers, ostrich tendons, all this sort of thing. I tend to stay away from the sort of rawhide chews and, you know, the sort of stuff with rubbishy ingredients. I'd rather go for something that was a little bit more natural and had maybe just a single ingredient rather than a huge amount of enums and preservatives in. I think that's quite important. So yeah, so just stimulating the chewing. Toys can be useful to stimulate chewing, get the saliva going again. So just self-care from the animal themselves, and the way you feed them, and the treats and the toys that you give them can help. Anything that they can really chew on will really help to get rid of that plaque and that biofilm. It's not so much getting rid of it completely, it's more about just disturbing it, and letting the body's natural defences get rid of it. So we talked a little bit there about what the animals like themselves with regards to their chewing. There is definitely a genetic component to this as well, and there are definitely individuals and definitely breeds which are more susceptible to getting dental issues. So, you know, long dogs, greyhounds, Yorkshire Terriers, lurchers, they're all more affected by dental issues. And I don't see that it's a particular difference in the chewing. There must be a difference in the quality of the enamel or the genetics of the antibacterial system within the mouth, something like that. But yeah, they tend to be more of an issue. So what else can be done at home? Let's put dent sticks to one side. You've got them chewing. They're still, you know, they're on a food which they really have to chew on. You're giving them, I don't know, antlers, or like I say, these twisted tendon sticks, that sort of thing, and they're still having problems. What's the next thing that you can do? Well, you know, there are these various mouthwashes and things out there which have an antibacterial in them, chlorhexidine usually. They can be effective, and some people find that they're a useful part of any dental care regime. Another thing that you can do is brush their teeth, and there are, you know, I suppose this video has actually been stimulated by a question on our clients group about electric toothbrushes, and yeah, I think toothbrushing, if you can do it, is brilliant. There aren't a huge number of dogs which will tolerate it. Initially you have to train them to it. So going up in order of effectiveness, you've got your bog standard toothbrush with doggy toothpaste on there, and that can come either as a soft, like one of ours, manual toothbrush, or a finger toothbrush for smaller dogs or dogs which are a bit wriggly. Yeah, they can help. In terms of getting rid of that plaque, I think sort of rubbing on dogs' gums, they don't really like it. Electric toothbrushes tend to be better, especially with a softer head. They tend to tolerate it that much more. And within that class, you've got your standard motorised toothbrush, which I think is fine. I suppose gold standard would be these ultrasonic toothbrushes, which are really, really high powered. And essentially what they're supposed to do is create cavitations in the liquid, the saliva and the water and the toothpaste. The toothpaste usually doesn't foam too much to create these cavitations. The foam is essentially air and it's no good for creating cavitations. You need a really sort of dense, liquidy toothpaste for this. Creates little micro bubbles in there, and as they collapse, they create little shock waves which shake off the bacteria. They definitely do work a little bit better, but they are substantially more expensive. I mean, substantially. You can get a motorised toothbrush from Boots for, I don't know, 15 quid. You know, an ultrasonic toothbrush can be, you know, £100 more. I think the Emipet is £150. I'm not convinced that the extra money is completely worth it. I think a good toothbrush is a toothbrush that you can use. Okay, so that I suppose toothbrushing would be the best thing. But I completely appreciate that it's difficult in dogs, and in cats can be virtually impossible sometimes. So, you know, my dog Moss is a long dog, and we do give him things to chew, and we try and look after his teeth. But you know, like I was saying, genetics, it does become an issue, and I find that sort of every 2 or 3 years or so, I have to knock him out, and I have to do a scale and polish like you or I would do at a dentist. And essentially, what we do with that, we get an ultrasonic scaler, so the tip of the probe vibrates extremely quickly. And it generates shock waves, these cavitations in the toothpaste which collapse and cause the bacteria to be shaken off the side of the tooth. So yeah, it's much more effective than a motorised toothbrush, and it really gets rid of all the plaque and calculus that builds up over time. The calculus, which is really firmly adherent to the teeth, it's probably the only thing that effectively gets rid of that. And if you go back and remember, I was talking about the little pocket by the side of the tooth there. We can get under there and we can send the shock waves up in there and clean it all out. And then once we're done, we can polish it. We can try and polish away all the little pits and abrasions that the calculus and the decay has caused on the enamel on the side of the tooth. Try and get it smooth and shiny with essentially a grinding paste. I suppose the downside of it is that you've got rid of it all, but then you end up with a dog which essentially still has the same causative problems, either genetics or the way it eats or anything like that there. So, once you've had a dental, I think it is important once your dog or cat's had a dental, it is important to have a think about how you're going to change the routine for them in the future to try and prevent these issues coming. But I think sometimes you just have to kind of resign yourself to the fact that, maybe in 3 or 4 years' time, you might have to do this again. And on that note, age is a big problem because, you get to 8 or 9, young dogs don't tend to have so much of a problem. They get to 8 or 9, we do a dental, and then they might need another one when they're in their teens. I'm not too worried, I have to say, about knocking out older animals for teeth. Touch wood, we've never had a problem here at all with knocking out older animals. We have qualified vet nurses watching the anaesthetic. We'll do pre-anaesthetic blood tests. We put them on fluids during the operation. All these sort of things to try and help with managing risk there. But it's definitely more of an issue if they've not had the dental when they needed it at age 10, and then they're having it at 13 when the problem is twice as bad. They're 3 years older, so 21 years older in our years, and they are more of an anaesthetic issue. So I would say a stitch in time definitely saves 9 in those cases. So to summarise, there are dogs which have problems, cats which have issues as a result of genetics or the way that they chew. Look at routine, and really the only way of getting rid of calculus is professional cleaning. If you've got any questions, give us a call here at the surgery, or pop your animal up to come and see the nurses here, and they'll open your pet's mouth and have a good look round all the teeth, and they'll be able to give you an idea of what perhaps needs to be done or what you need to change. And yeah, I hope this is helpful, and I'll see you all soon. Bye.